Hello everyone, this is Lab 8G4 group. We are going to summarize a medical paper in Pharma group, our paper called Nivolumab in Advanced Hepatocellular Carcinoma for Sorafenib-experienced Asian cohort analysis. Our content, introduction, methodology, results, conclusion, and the references. So let's begin our journey. At first introduction, among all the cancers in the world, liver cancer came in the sixth arrangement between them, and it's also the fourth most common one that may lead to death. If we imagine liver cancer is a big pie, then about 90% of this pie will be the advanced hepatocellular carcinoma. Now let's talk about our disease. It's an asymptomatic disease, so logically it will be diagnosed very late with many different causes, which is the problem that put us in a bad need for systemic therapies. But unfortunately, we are restricted by very limited options of treatment because of all the differences between patients, especially between Asian population and versus other populations. So that's very important to find a multiple different treatment. Our drug of interest is Nivolumab. That's a drug worked in the patient immunity to enhance the immunity to attack the tumor, as it's a monoclonal antibody and also a checkpoint inhibitor. If we are the authors of this paper, what will we aim to? We must need to prove that Nivolumab is a safe and effective drug for Asian population and non-Asian population. Methodology. Our checkmate study is an open-label study that has been done in multiple centers using increasing different doses for phase 1 and phase 2 in the clinical trial. In our studies, there are many common points between all populations, like their ages, their history with disease, Sorafenib experience, if they infected or not, and their probability to cure. To know the safety of our drug, following up would be done every 3 months. The checkmate point 4-point study has approved the safety and tolerability for dose escalation phase and ORR, which mean objective response rate. It also was approved by the Institutional Review Board with good clinical practice guidelines. The results of our data. That's an infograph that shows some points taken from the medical history of the population's life, their median age, their infection history, and their stage of disease, B or C. About the efficacy of the drug. There are many abbreviations like ORR, DCR, CR, PR. These abbreviations are very similar for both populations. The authors had found that there was a huge gap in the median duration of response between both populations, but they didn't find any remarkable differences between both populations that related to the etiology. Also, the survival rate was similar for both populations. The safety of the drug would be recorded after 30 days after the last dose. Rash and fatigue are the most common side effects, but unfortunately there are many dead participants. Finally, with our conclusion. Now we can say that Nivolumab is a safe drug for both populations, especially with people who have Sorafenib experience, despite all the differences between them. But we didn't allow enough to say that Nivolumab is the effective drug for both populations until doing phase 3. Our references. Thanks for your attention.